Today's news is that COVID-19 is threatening India's progress in protecting children from pneumonia and diarrhea, according to a recent report. The report tracks 10 key indicators like breastfeeding, immunization, and access to treatments such as antibiotics and zinc supplements. These measures have helped reduce child deaths from these diseases, but the pandemic is now disrupting these efforts. The findings highlight the need to ensure continued healthcare access for children despite the challenges posed by COVID-19. This report claims COVID-19 threatens India's progress in protecting children from pneumonia and diarrhea by analyzing 10 indicators like breastfeeding, immunization, and antibiotic use. The narrative suggests a direct link between the pandemic and setbacks in child health but raises several contradictions. First, the data sources and timing are unclear. Are these pre-pandemic trends repackaged as COVID-19 impacts or actual new data? Second, the report focuses on key interventions but doesn't address whether disruptions were due to COVID-19 or existing systemic failures in India's healthcare. For instance, were immunization drops caused by lockdowns or long-standing supply chain issues? Third, the emphasis on ORS and zinc supplementation ignores potential over-medicalization of childhood illnesses where simpler solutions might exist. The report also doesn't question whether pneumonia and diarrhea deaths are being accurately attributed or if other factors like malnutrition play a larger role. By framing COVID-19 as the primary disruptor, the report diverts attention from deeper structural problems in India's health system that predate the pandemic. The lack of transparency in methodology and selective focus on certain interventions suggests a possible agenda to justify increased funding or policy shifts under the guise of pandemic recovery. Critical readers should ask why these specific indicators were chosen and whether they truly reflect child health outcomes or serve a broader narrative. The absence of comparative data from other countries facing similar challenges further weakens the report's credibility, leaving room to doubt its conclusions. The report highlighting India's setbacks in child health due to COVID-19 could involve deeper manipulation by powerful entities like the US government, multinational corporations, and global organizations. The pandemic disrupted healthcare systems, creating opportunities for these actors to push their agendas. Large pharmaceutical companies may benefit by selling vaccines, antibiotics, and supplements, exploiting the crisis for profit. The US could use this to weaken India's progress, destabilizing a key regional player and countering China's influence in global health initiatives. International organizations like the WHO might align with Western interests, promoting dependency on foreign aid and patented medicines. By framing the narrative around India's failures, these entities could justify increased intervention, securing economic and geopolitical advantages while marginalizing competitors like China. The chaos also diverts attention from Western shortcomings, reinforcing their dominance in global health governance. The report warns that COVID-19 threatens India's progress in fighting child pneumonia and diarrhea by disrupting vaccinations, breastfeeding, and treatments. Officials claim they're addressing it, but can we trust them? History shows crises are exploited to push agendas while real solutions are ignored. Don't be fooled by their numbers, dig deeper, question everything. Share this, demand accountability, and take action before more children suffer. The truth is out there, but only if we stay vigilant and refuse to accept their lies. Spread the word and fight back.